Good morning, everyone, for joining us on this special webinar focused on Orange County's situation as it deals with the coronavirus, the state of the economy, and perspectives and plans for Orange County businesses, especially for the immediate future. Before I start, I would like to introduce three distinguished Orange County leaders who are joining us today, and they will provide their own outlook on these issues. Given their deep knowledge of Orange County and experience, we couldn't have chosen a better panel. Immediately after I make my presentation, Mark Costa, Senior Vice President and Area Manager of Kaiser, will give us an in-depth look at the coronavirus and how the county is dealing with it. Kaiser delivers care to 600,000 of Orange County residents, the largest healthcare provider in Orange County. And Mark has been in the healthcare field for 35 years. Then Lucy Dunn, President and CEO of Orange County Business Council, the most significant business organization in Orange County, will follow. Orange County Business Council, a dynamic organization of leaders of Orange County businesses, works with academia and government to ensure the county's prosperity and high quality of life. Joe Hensley is market president of US Bank, the fifth largest bank in the United States. Joe is actively engaged with the Orange County businesses and philanthropic organizations and has firsthand knowledge on the state of the local businesses. So let me begin with a quick overview of the state of the economy and then follow that with the results of the survey that the Woods Center has recently conducted of Orange County businesses. Let me begin at, take a minute, share my screen here. Reopening Orange County business, how is it going? Well, there is no other way to start but to look at the virus. Now, this is something that is not going away. The virus is not going away. It has been around for over 3 months now, and we thought we had controlled it, but there is a second, some people think it's the same continuation of the first episode continuing. Now, globally, the virus, as I'm sure you've seen these numbers, over 10 million people have been infected, 500,000 have died. US has the largest number of cases and deaths of any other country. 2.5 million people sickened and 125,000 deaths. The situation varies across states, as you know. California thought that we had controlled the spread, the speed of that. But like many other states, we are facing a resurgence of both cases and deaths. In Orange County, the numbers are very similar. We have been going up, and we hit the highest mark of 485 cases in one day, I believe on June 24th to 25th. And since then, the picture has been mixed. Most recently, however, the numbers appear to be going up again. I will leave Mark to give you a lot more detailed analysis of these numbers for Orange County. But let me turn to the economy. The coronavirus, as you know, led to a clampdown, a shutdown of the economy, and that led to huge unemployment as well as fall in total output. Unemployment claim, which is a weekly number, as you can see from the graph, jumped from being under 200,000 or 300,000 per week to 3.3 million, then 6.9 million at the end of March. Since then, the numbers have been coming down on a weekly basis, but we lost about 47 million jobs during that time. Now, the number of continuing claims is also at a high level. You know, some people were recalled as the economy started to open up, but there's still about 20 million people who have who are in the unemployment insurance claims category, and that number has not gone down a whole lot recently. So we're going to have a continuing high unemployment situation as the economy struggles to regain its strength. Unemployment rate shot up. In the US, it shot up to 14.7% in the month of May. And for the reports came out in June, it came down a little bit to 13.3. In Orange County, the number, most recent number for May is 14.5%. Orange County numbers are not seasonally adjusted, so they vary a great deal. But usually Orange County is very close to the national numbers, maybe % or 2 below that. Now, the shutdown of the economy led to a huge, massive activity on the part of both the Federal Reserve Bank and the federal government in supporting the economy and people who lost their jobs. As you know, 3.5 phases or 4 phases of fiscal stimulus were approved. And that stimulus is substantially larger than the total stimulus provided during 08-09, the Great Recession. The stimulus in the Great Recession accounted for only about 5.9% of GDP, while right now we're already at 13.3% of GDP, total stimulus being about $3 trillion. And given that the economy is still in a rather uncertain territory, we expect a 4th phase of the stimulus. And I think several categories where the help is needed are clear. Small business loans need to be supplemented, and the unemployment insurance will be extended. We also believe that states and local governments who are desperately need money will get something from that. So a minimum of the phase 4 amount that we estimate will be about $700 billion. Very likely it's be much higher, maybe significantly higher. It all depends on the politics of the day. But there's no question that economy will need support for quite some time, for several months and maybe well into next year, so as not to fall in a deeper recession than it already is. Stock market, and I'm sure a lot of you are observing that, looking at your IRAs and retirement funds, has done a miraculous recovery, in fact, if you look at the numbers. It fell about 35% from early March to the end of March, a very sharp decline, until the stimulus package was approved. And then since then it has been improving with ups and downs, as is common to the stock market. And in terms of percentages, it has gained about the same 35%. Of course, it's not at the same level because we're starting from a much lower level, and 35% from lower level is not quite the same as the high mark that we hit in May. We see other signs of improvement in the national economy and the local economy because of opening up of the economies nationwide and the stimulus that the Fed and fiscal policy has provided. Looking at restaurants, for example, both in California and San Diego, after shutting down completely, there is uptick in both areas. And of course, this is subject to further restrictions as the coronavirus numbers start to rise again. If we look at Google data, which is real-time data, that also shows much more activity by households, by individuals visiting parks and retail centers and recreation compared to what happened in end of March, April. But again, it is subject to restrictions, slowdown rather, as further restrictions are imposed. Some other good news is that new businesses filing, which is an indicator of business activity at the small business level, has shown improvement, as has debit and credit card spending by consumers. It's still well below the level at the beginning of the year, but it's not as bad as it was a couple of months ago. Now, what will be the shape of the recovery? A lot of people have been talking about a V-shaped recovery. They may be having second thoughts. now that the virus has picked up speed again. And we have believed right from the beginning that it will be a W-shaped recovery rather than V. In other words, there'll be sharp uptick as the economy starts to open up. But as the virus continues to keep its hold, that initial momentum will fade for a while, and then the recovery will start again once the vaccine is discovered and distributed more widely. We, however, believe that even at the end of 2021, next year that is, GDP growth will be still below the rate at the beginning of 2020. Our forecast of a 5.2% decline for 2020 and 1.8% gain for 2021. Unemployment rate, similarly, the national unemployment rate probably has peaked, but still will remain high through the next year. 10.5% average rate for 2020 and 6.8 for next year. Orange County has a very similar story. We estimate, we project that this coming quarter, which is ending today, the average will be 12.1%, and then Orange County rate will start falling. But again, even at the end of 2021, we expect about a 5% unemployment rate, which is high for Orange County because the low rate typically is under 3% or 3.5%. So these are our forecasts for Orange County's unemployment rate. Now, Orange County's unemployment claims have been declining. They shot up in March and April, as you can see, percentage of labor force. In May, they have come down. So same story holds for LA and Riverside and San Bernardino County. Is pretty much the similar story that we saw at the national level. Now, unemployment rate in California and Southern California has an interesting story. It has reached 16.4% for California. Now, the maximum it hit during the Great Recession of 08-09 was 12.3%. So we are well above that rate, not only in California, but in Orange County as well, where the Great Recession saw a rate of 10%, and now we're already at 13.8, 14.5%. Same is true for LA and Inland Empire. In addition to EDD data that I just shared with you, Woods Center undertakes an independent survey every quarter. We've been doing it, this is the 19th year, and we just concluded the most recent survey in the third week of June, about a week or 10 days ago. Now, we create, we create an overall index that provides us a measure of the overall sentiment. And before I share that, I'm sharing this short poll with you to see how many of you actually got the survey, filled it. If you could just answer, please, yes, no, not sure. And then quickly, and we will continue with the presentation of the results. So this overall index that we create is based on 10 or 12 questions that we ask people. And we summarize that information in an overall measure. Any value over 50% indicates an improving situation. Anything below 50%, not so. I'm going to end the poll right now. Thank you very much. I can share the results if you like. Here they are. But let me close it. So that index that we create, we call it the OCB BX index, fell to 22.7% from being above 20% for the first quarter of the year. The survey was conducted at the end of March, just when the coronavirus was starting. This value is high and lowest ever, except for the 08-09 period during the Great Recession. Now, the most recent survey that I just mentioned, conducted in June, the index went up to 62.9%. Still nowhere close to what it was before the epidemic started, but a substantial improvement. Employment, payroll employment, that you see here fell, we believe, by 15%. We still don't have the complete data from EDD. We will see a similar uptick in employment in the second quarter, but still below the normal situation. When we ask people what are the things they're more concerned about as far as the business is concerned, believe it or not, it wasn't the monetary policy or the fiscal policy. Only 7% expressed a concern that Fed may be expanding money supply too much, and 12.7% thought that the fiscal latitude was too high. Federal government was incurring too much debt and spending too much money. But the biggest concern, almost 72%, was about the political instability, political and social instability. Given the state of the politics today and the election coming up, and the social upheaval that we see because of Black Lives Matter and other issues of inequality, is not surprising. The business people are concerned about that as they're affecting their businesses and demand. Now, we asked several other questions, and I want to share the results for some of those with you. When we asked them what they expect their profitability to be in Q3, in the coming quarter, compared to Q2, as you can see, it's substantially improved. In Q2, the survey conducted in March, 78% expected their profits to decline. But now, for Q3 that is coming up, only 33% expect profits to decline, 41% expect profits to improve, and 26% to stay the same. A similar story for sales. Compared to 72% who expected sales to fall last quarter, in the coming quarter, 46% expect sales to improve, and 23% expect it to be the same. Hiring story is really interesting. Last quarter in March, when we asked them, only 4% expected to hire more people, while 50% expected to reduce their payroll, and 46% are going to keep it the same. Now, 41% expect to hire more people in the coming quarter. Good sign for people, residents in Orange County. More people will be hired. And only 33% expect a reduction in their workforce. Now, when we'll, let me go to my last slide, basically. We asked the business executives, when do you think you will return to the pre-pandemic activity, January, February level? 23.9%, 24% of them said by the end of this year, they expect to be at the same level as at the beginning of the year. And then Q2 and Q1, by the middle of next year, another 38% said that they expect to be at the same level at the beginning of the year. But only about 20%, 19.7% expect that they will not get to that level until 2021, a year and a half from now. And that's a very interesting graph, we think, the expectations of our business executive as to how they see the economy and their personal business evolving. I'll let our panelists comment on that in just a minute. But as to when this deep freeze will end, when the virus will give up its control, all I can do is quote our eminent epidemiologist expert on that. We don't make the timeline. The virus makes the timeline. So we don't know when that will happen. And so I'm going to stop here, and I'm going to turn this over now to Mark Costa to give us a little better picture on how the coronavirus is affecting Orange County. Mark?
All right, thank you, Anil. What I want to do is really take us back to mid-March to today. Hopefully be able to express to you as employers, as citizens of Orange County, what the health system has done to help assure that we've got the necessary capacity and responsiveness to those that are ill, both with COVID, but as well as, obviously important, our other illnesses. and other healthcare needs. You know, as a county, we did an excellent job, both as citizens and as a health industry, between mid-March, when this all started, I'd say, to about mid-June. During that period, Orange County definitely had a lower incidence of infected individuals and of hospitalizations, and that served us well. That allowed our health systems to work with our county health department, our emergency medical services staff, to really plan and prepare for potential surges. This allowed us to get our PPE, our protective equipment, in place. It allowed us to get ventilators in place. It allowed us to put capacity plans in place that across our county enabled us to feel that we were prepared to literally double the capacity of needed critical care beds, not only within Kaiser Permanente, but all of our hospitals across the county. And so that really, really served us well. And so everyone's actions, and it put us in a great position. You know, the other thing that happened during those first few months is, you know, the citizens of Orange County are consumers of healthcare. And what we saw during that period is a change in the needs of those consumers. You know, the individual citizen was very aware of protecting themselves, protecting their family members, not only through sheltering in, but in terms of how they demanded healthcare be delivered. Within our organization, Kaiser Permanente, we moved from having about 10% of our visits with physicians that were done through telemedicine and 90% through face-to-face, shift almost completely. Today, we are delivering about 20% face-to-face. We're moving towards 50% as we open up more services. But we hit during those months up to 80, 90% of the appointments were done through telemedicine. And so, you know, our healthcare system was able to optimize the technology that we have, enable us to get access to physicians, physician specialists, nurses, so that care could continue to be accessible, you know, to members of our county. We also saw this in other areas. We saw it in our pharmacy, where we moved from about 25% of pharmacy, we call them scripts, orders, to now 50% being done through mail order. Again, enabling our citizens to not have to expose themselves to risk in, you know, in our facilities. We also saw a change in how people wanted care for the elderly. In our county, fortunately, we did not have the level of infections in some of our congregate housing areas for seniors and our skilled nursing facilities as some of the Inland Empire and the county saw. Yet seniors still wanted, whenever possible, to have the necessary support to deliver the care at home. So home care services really has expanded and has seen greater demand. So we've seen a lot of good planning. We saw a lot of consumer changes, and we've seen our health systems respond to those changing demands. And then we hit about mid-June, and a lot has changed since then. The testing for positive tests are up 5 to 8 times what we've seen. And you'll read that, yes, is some of that because we're doing more tests? Yes. But we also know we're seeing a much greater incidence of infected individuals, and that then leads to hospitalizations. Within our own hospitals, our 2 hospitals here in Orange County, we now have seen a major increase in the need for hospitalizations of COVID patients. Today, we're sitting at around over 3 to 4 times the need for those beds than we were seeing in the first 3 months of the pandemic. So that's important. And I'll tell you why it's really important in terms of what we do as employers and what we do as citizens to try to bring that curve down. I think I mentioned earlier, our hospitals throughout Orange County, all the health systems, felt that we could double our capacity overall. And we haven't yet hit our max. But let me tell you what's different today. In March, when we really all were sheltered, a lot of healthcare was shut down. Our surgical systems, operating rooms were shut down. Many of our medical office buildings were shut down to protect everyone. And in part, what the shutdown was about was to be able to redistribute physicians and nurses to really respond to what we were worried about would be a major surge, i.e. what we saw was happening in the state of New York and the city of New York. And so the redistribution of clinicians, as well as increasing our bed capacity. Well, today that's not the case. We've needed and wanted to stand back up our medical office buildings, our surgeries, our operating rooms, because we've gone about 3 months where care potentially has been delayed, and we have citizens that need the care now. So today we're in a very much different situation as the demand for hospitalization increases, and that we don't have the capacity on the human side that we had in the early months. We still are in a good position and are meeting every day, the demands, but we really need to start seeing the curve flatten and the curve to go back down. And now we've got to look forward, because I think we know today that this is going to be a long journey. And so as we look, as we approach the fall, our hospitals across Orange County and really the state and the nation are all going to feel the same thing. We are going to see the demand for patients that have COVID. In our 2 hospitals, just as an example, we'll have around 350 patients in our hospitals on an average day. And right now we have around 70 to 80 COVID patients. Those are patients that weren't here a year ago. And so that has created a new demand. We're also seeing a demand for patients that are now getting those surgical procedures and other procedures that require hospitalization. We have a backlog, if we're all honest with ourselves, because care wasn't as accessible during those 3 months. We're now also going to start approaching the flu season, or what we call the winter season. And hospitalizations during the winter, because of respiratory infections, non-COVID infections, also increases demand. So, we have to, 1, build our capacity, and 2, do what we can as employers and citizens to flatten that curve, to help make sure that we've got the necessary capacity as we start hitting a phase where, I think we all believe the demand for hospitalization is going to increase, not just because of COVID, but because of some other demands. The other thing that we are really focused on as health systems is, learning along the way. And the good news is we are learning. We have new medications that now can be brought to the bedside to patients that have COVID, that is improving the mortality rates. We are also very aware of the importance of mental wellness as well as physical wellness as we shelter in. And so, all of us as employers, I think, have a responsibility to communicate and educate to those that we work with about keeping ourselves well, again, both physically as well as mentally. It's going to be a long journey. We have to assume it's going to be a long journey, and we have to take the tactics and the strategies that enable us to get through this. And again, as a healthcare leader, I'm very confident in our county, our health departments, and our fellow health systems in terms of how we will work together to make sure we've got the capacity no matter what the medical need. Thank you, Anil.
Anil, you're on mute.
Thank you, Lucy. I said I'm going to turn it over to Lucy, but before I do that, let me remind our participants to please submit your questions for our panelists. We have a great set of panelists and want to take advantage of the knowledge. Lucy, please go ahead.
Thank you very much. And I'm going to share my screen here a little bit, because what I love is my opportunity not only to commend Dr. Puri for his excellent survey and presentation on the economy, but I love connecting the dots between that survey, business expectations, and also the health presentation that Mark Costa just shared with us. And so one of the things I really wanted to focus on for this webinar was remembering that good health is good business. It is a byline of OCBC at this time. And the confidence that our business leaders have today in opening up and feeling that they're going to get back to normal is directly proportional to how confident are your customers going to be coming and returning to your place of business. How confident will your workers be that they're coming to a safe place? So here are a few slides that the Orange County Healthcare Agency and OCBC put together, where we are doing weekly, if not more, webinars to share with folks best practices and healthcare orders that are in place. So the first thing I'd like you to do is make sure, get out your smartphones, because I'm going to go through these slides very quickly, and there's going to be a couple you're going to want to take a picture of for future reference. But if you let Dr. Puri know, let me know. I'm happy to send you this full deck so that you can see it. First and foremost, wear a face covering. Wear a face covering. It's required. And it's the best first line of defense. We see it working in other countries. We know it will work here. We are the only nation in the world that seems to be politicizing face coverings. Don't do that. Mask up, everybody. Mask up and just do it. Most of our businesses are now open. We know that now from watching the governor. So keep an eye on this, but I will share with you industries that are not yet opening are, of course, live performances, musical performances, festival, theme parks, etc. But also you need to watch for updates now. In our state, we're starting to tick up again in our numbers. And so we notice that all bars, for example, previously opened in LA have now been shut down by the governor. San Diego is shutting down their bars. Riverside is shutting down their bars. San Bernardino County is voting today to shut down their bars. Hint, Orange County, be aware. 4th of July is coming, and that's going to be probably something you all need to be aware at. In fact, even LA beaches have been shut down. So watch and listen for updates to protect our health. All right, there are, by law, in Orange County and the state of California, there are 3 steps to opening your business safely. You gotta find your industry guidance. You gotta post publicly a checklist in your place of business, and you have to post publicly an attestation. I'm gonna run through these really fast. First step, find your industry guidance here. You might wanna take a picture of this slide. This is where the guidance is located, right here. And take a look at that for what industry you are. Are you retail? Are you restaurant? Are you a shopping center? Are you an office? It's all there. Some have guidances, some have checklists. Here's what a checklist looks like. Don't freak out. You're doing this stuff anyway, but you should be aware, retail, restaurant, office. This is what your checklist looks like. Again, some industry sectors don't have checklists, they just have guidance. If you have a checklist, you got to do it, and you got to post a copy of it. Step 2, post that checklist after you do it. Step 3, then in Orange County, you're required to post an attestation, a document that says these 5 steps, that you've done a risk assessment, that you've trained your employees, that you've implemented control measures, that you've done disinfecting, and that you've implemented physical distancing guidelines. You are required to post this. What does it look like? It looks like this. OCBC wrote one for you. Take a picture of this one. It's just that easy. Just sign it, date it, and post it in a public place so that you can operate business safely. You do not have to file it with the county. No one is going to double check. It's just your customers are going to know that you're doing safe practices. And by the way, it is a healthcare order in Orange County to do this. There's also a hotline for questions in Orange County, brand new. This is a good number to write down, and or you can email your questions to eteam@ochca.com. That's Orange County Healthcare Agency.com. They will answer your questions about this. And last but not least, here in summary, a good slide to take a picture of. Find your industry guidance, complete and post your checklist, complete and post your attestation. And then if you want to actually ask the healthcare officer, Dr. Clayton Chow, specific questions on this, he and I are doing another webinar on Thursday, July 2nd from 10:30 to 11:15. We're going to run through those same slides, but we're going to answer your questions about them. And you can register via Zoom right here at this link. So take a picture of this slide and then we will take care of it. So that's it for the simple for your healthcare practices. And I would encourage you to remember that you need to do the right thing. One last thing, in addition to doing masks, mask up, people. I want you to remember what Mark Costa said. Flu shots could never be more important than they are this year. And that's just the regular flu, right? We don't yet have a vaccine for COVID-19. So when that vaccine comes, line up for that one as well. But right now, think about getting that flu shot done in the fall so that we don't, again, overwhelm our healthcare systems. Masks, flu shots, and then make sure you do the safe practices. So thank you, Dr. Puri. No irrational exuberance out there for you business people. I don't want to see any irrational exuberance. You got to do the right thing and make it safe, again, for both your customers to come back so that you can be correct on when you come back to work and we get back up to these pre-COVID numbers, but also protect your workers as well so they will want to come back and work for you. So that's it. Thank you, Dr. Puri. Thank you.
I agree with you. This is not the time for exuberance. This is the time for restraint.
Exactly.
And that's the smart way to go about it.
Right.
And protect yourself and protect others. Joe, let's hear what's your take on what's going on.
Thank you, Dr. Puri. First, I'll start with the banking sector. This is significantly different than in the 2008-2009 Great Recession, where banks were sort of part of the problem at that time. You saw a lot of bank failures. You saw a lot of acquisitions. Banks are actually fairly strong during this period. Most of us went through our stress test in the last couple of weeks. So one of the things that we noticed in the first few months, deposits and loans grew, and primarily because businesses were concerned about 2008 and 2009. So a lot of companies did what they called defensive draws. They drew on their lines of credit, and then they put that money back in the bank. And so our loans and deposits, and I'm talking in the banking sector as a whole, not just US Bank, grew at a pace of, in 2 months, greater than 3 years worth of what we would have grown at. Now that seems very positive from the perception that you would think we would be making more money, but when the Fed takes the rate down to zero, that really reduces our ability to make money and takes liquidity out of the market and sort of affects banks on a negative level. Banks have been very involved in our communities during this time. We have kept our branches open. One of the things that we have seen, and you will see branches closing among all different banks during this time, and they may even be closing right now just because traffic has slowed to the point because people are finally starting to use the apps and connect electronically. We've seen more connectivity electronically in the last 3 months than we did in the last few years. And so as people grow comfortable, they're not coming out as much, they're not going to the branch, and so as such, we are closing down some of the branches and deploying some of those people who can work to move in other parts of the banking industry. One of the things that was rather surprising here in Orange County is mortgage demand is still extremely high. And not only refinance because rates being as low as they are, but new purchase as well. Our new purchase volumes are significantly higher than what we anticipated, to the point where many banks have a backlog of up to 90 days, which is unusual considering the situation. So that's just a little bit about banks. I don't think you'll see a lot of bank mergers this year. I think that everybody's just sort of clamping down and sort of trying to move forward to the next step. I will say this in conjunction with what Lucy shared, and that is all banks as well as retail stores have a right to refuse service for people who do not wear a mask. So I just want you to be aware of that. I know we've seen a lot of funny memes and different things about people who haven't worn masks or who have gotten upset because they were told to wear a mask once they entered a store. And you know, I went to Trader Joe's this week and I waited outside. You have to wear a mask to get in, and it's, you know, it's just the right thing to do, guys. So next, I'll sort of switch over. I've talked to clients, and I talk to clients every single day. And I've seen a lot of changes over the last few months. We had customers that were closed down that were allowed to open in phase 2. Their businesses surged and soared to the point where they may end up breaking even this year, or their sales may be the same as last year, which is phenomenal if you consider you took out 2 to 3 months of their revenues. On the other side, we have hospitality, recreation, restaurants. Even though restaurants are open, their seating is at about 50% of what it used to be. And so it creates a challenge for restaurants, retail, small businesses. Even the hospitals were affected somewhat in the first or second quarter. And you know, especially here in Orange County, trade shows, I think of the Anaheim Convention Center, and all these things have been negatively affected. There are some positive effects out there. I mean, some businesses that are doing well. And if you look at commercial real estate, industrial space is just booming. Amazon's doing quite well right now. If you look at Inland Empire is a real bustling around as far as the number of packages they're receiving through their centers with UPS and FedEx and etc. So there are spaces that are doing well there. As far as commercial real estate go, retail and office space are a challenge right now, and office space is a real concern for the future. With everyone working from home, a lot of companies are finding out that this is working quite well and quite efficiently. And so where do we go from here as far as our office space, and how much money could we save if we allowed our employees to work from home? So I think you'll see some challenge there ongoing in office space and in retail as well, but industrial is booming. With that, my last point I wanted to make is strictly about Orange County. All the banks in Orange County are very connected to our nonprofits. And Orange County is one of the most generous counties I think I've ever seen in my life. And our nonprofits, yes, they are hurting, but many of you have stepped up and you've made sure that they're on stable footing. You volunteered time, you volunteered money. Most of these nonprofits, many of them, I should say, make their money by doing events. Most of those events are canceled for the year. So many of you have reached out and found other ways to support these nonprofits. And I want to commend you and say thank you for everything you've done for the community. And with that, Anil, I'll turn it over to you for some Q&A.
Thank you. So, Mark, is there anything you want to add to what you just said about businesses?
Yeah, just a few additional points. Lucy did a great job in guiding employers. A couple other things. One, all of you as employers should be looking to your health plan, not just as an entity that helps cover for people that are getting sick, but really for public health guidance. We don't think of that often, and we should be. Most other countries do. What do we do to keep our public healthy? What do we do to keep our employee workforce healthy? Your health plans, like Kaiser Permanente, we have guide playbooks to help employers be safe as they transition back to sort of the new normal. There's webinars. Reach out and get information so that you know how best to keep your employees and your family safe. Reach out and get information on an ongoing basis, because we're learning. Standards change, suggested protocols change, so do it on an ongoing basis. As a large employer, we're finding the importance of communication to continue to update our workforce in terms of what we're doing to protect them, what we ask of them to protect our consumers. So continuous communication is essential. Now, for some employers, as you showed, Dr. Puri, there have been layoffs. And as employers, we all can support our workforce that potentially has lost access to health benefits to transition to other health plans. And so here in our county, we have CalOptima. In our state, we have Covered California, which helps to subsidize or cover 100%. And so, if somebody had Kaiser Permanente and they lost their job, there's a very high likelihood that they can stay on their health plan with us through these other means. And I think as employers, we may be looking back to rehire some of these employees. It's a good faith act in helping people transition, in terms of health coverage. And then again, I want to emphasize the importance of supporting our workforces with their mental wellness as well as their physical health, because we know that so many families are feeling some negative outcome during this pandemic. It could be their economic wellness, it could be the health of their family members, it could just simply be the isolation and the unknown. And so finding ways through employee assistance programs and other apps that are now so available, again, I highly recommend that we all take that as a high priority. Thank you.
Thank you, Mark. We have gotten several questions, and I'm going to ask Daniel to read some of those so the participants can hear what the questions are, and the panelists, whoever likes to, you can take those questions on. Daniel?
Okay, so the first question is, what is the hospital bed capacity and the medical staff capacity for Orange County to handle this pandemic?
Okay, I guess that one would be to me. And, hospitals have what are called licensed beds. Those beds fall in different categories, from critical care to telemetry to med-surg. I can't give you the exact number of beds, but we've got thousands of beds across our county. Those beds are not being fully utilized today, but with COVID, there is a high demand on critical care beds. And so as I said, during those early months, we really were doing what we called surge planning to say, what are we going to do if the demand is greater than the beds that we have? And so, what we identified is we could double that capacity, okay? Some of that would be going into spaces that aren't normally used for critical care and hospital beds. Recovery rooms have the kind of monitoring equipment necessary, the kind of staff that's necessary. But the county has gone beyond that. Most of our hospitals have the ability to set up tents that can deliver ICU care in temporary facilities. We also know as a county that we can access other facilities that might be on the Fairview grounds, the fairgrounds, the Fairview Development Center, in other sites if necessary. So again, we want to focus on keeping the curve down and the demand down. But I would not tell anyone, at least with what I know today, that we have to worry about not being able to get access. But we all have that responsibility of keeping the demand down.
All right. Anil, the next one.
So the next question would be, when will the flu shot be available?
So while I sort of got a sneak at that and asked a couple of our internal experts, the flu shot should be available in about the middle of August. Again, I think I'm correct. It takes about a couple weeks to get the full impact of that flu shot. So early vaccination, immunization is going to be essential. So work with your healthcare provider, either to come into your site of care or to reinforce with your employees to start looking at the latter end of the summer to get those flu shots. Last year in our organization, we have 600,000 folks and over 300,000 did get a flu shot, a little over 50%. We need to get that as close to 100% as possible so that, we don't have a demand on these needed beds for COVID with folks that are suffering from other respiratory infections, such as, the general flu.
And may I also add to that too, in previous years, we've seen sometimes that flu vaccines may not be as effective against certain strains, but they still make it where people don't get as sick as they otherwise would. Is there a potential that there would be some carryover where it will help people who get coronavirus not get as sick as they otherwise would?
Yeah, I don't think we know that yet because we don't understand this virus quite well enough. But again, the point of getting a flu shot, even if it isn't the exact strain, to help us with the flu and minimize the impact, is why flu shots are so important.
Okay. The next question is, shall I read it? Please comment on the Fed's Main Street lending program. Joe, I guess that's for you.
Okay. First of all, let me start with PPP. PPP was a great success, both from a banking perspective as well as a business perspective. One of the problems with the PPP program was, trying to, SBA was just inundated with applications, and it was very difficult to get everything through in the first phase. Everything pretty much got through in the second phase. That program actually ends today, and they still have, I think, about 130 billion left. The other problem was they continued to change the rules during the whole time frame. What was forgivable, what wasn't, if you could get funds somewhere else, etc. And so that made it a little more difficult for those people who applied. A lot of them paid it back simply because they didn't want to take the risk that they missed something. The Main Street lending program, they actually worked on that pretty thoroughly before they released it, or they are releasing it. And the Main Street lending program is somewhat or very restrictive, I should say, and has a lot of restrictions in it. It is a good opportunity. It is a loan that you have to pay back. It's a loan. It's not something that can be forgiven. And some of the terms and conditions have been criticized by the public as being too restrictive. Banks now, all major banks are registering. I'm not aware of any that have been accepted yet. So over the next few weeks, we have to be accepted before we can start taking applications. And we'll sort of see how it goes from there. We're all ready to go. We're just waiting to be approved. So hope that helps.
I'll take the next question. It's about unemployment rates. Somebody asked whether these are available for finance, accounting, engineering, IT, and healthcare. Well, the way the government collects this data, they are not by industry. They are household surveys, as they call them. So, of course, the unemployment rate for certain groups, for example, people with less education, are much higher. And so, and also not everybody gets counted because some people are sitting on the sideline not looking for a job. So official rate is below the true rate that we see. But I think the next question I want to turn it over to Lucy, and that is we are carefully planning a partial or reopening of our office for early August. What are others doing? Are you seeing many offices reopening?
I think offices are slowly reopening. Remember, we're still under a state emergency order that says if you can work from home, you should continue to do so. And particularly for at-risk employees in the 65 plus category, you need to be at home. There are office buildings. I know in our own office building at OCBC, we're starting to slowly come back. Offices are planning for social distancing, mask wearing protocols. I give a great shout out to the Irvine Company, literally has produced guidelines for reopening their office buildings that help every tenant do specialty, protocols to help them. And there's opportunities as well for special cleanings. But again, as office buildings open up, there are specific checklists for office. And from my little slide presentation, you saw that checklist that is on the state's website that you have to complete and post in addition to the attestation. So yes, offices are slowly coming back, but not all of them. And it's a question of, again, making sure customers and workers feel safe. We also can see the evidence in that our freeways are not yet congested and our air quality has never been better. And I'm personally advocating for incentives for more and more telework and telecommutes, because I think it really helps with quality of life. So hope that helps answer some of your questions.
I'm going to take the next question, Daniel, excuse me. Somebody asked about the Cal State Fullerton enrollment and opening. Fortunately, Cal State Fullerton has no shortage of applicants. We have had the record number of applicants and admissions. The campus is planning to open online, fully online. And if conditions improve, which doesn't look like right now, they may go face-to-face in some classes, like lab classes, but most of the classes will be online. Daniel, you want to read the next question?
Okay, so the next question is, what are 3 critical objectives for Orange County working together with people, businesses, and nonprofits to achieve this year?
What are the 3 critical objectives?
Looks like Daniel would like to answer that one.
It's not clear what the question is. I guess staying safe it would be, and working together, helping people who need help, as Mark very pointedly referred to, taking care of our employees and workers, and getting through this with minimal damage. I think that is the challenge.
I agree with you, Dr. Puri. I would say one of the things that I've shared with our board, and our board has inspired us at OCBC, we all need to be able to say, how did we help others in the great pandemic? And we have to be able to tell that story when we're through this. And I think that is number one, the most important thing that we need to really take a look at is, how have you helped others? And in any of those 3 categories, have a good story to tell and have someone else help you tell your story.
2 more questions. Daniel, why don't you read the next one, and then we'll finish with Orange County.
Okay, so it seems that other nations in Europe have opened up without infection spikes. Why are we seeing them here in the US? And it's interesting too, in Europe, that they even have schools reopened, and it's the reopening is further along, and there hasn't been the infection spikes that we're seeing here in the US.
Well, I can give that a go. I think in some of the countries that are having the most success, it does seem to me that the level of discipline of wearing masks and doing the basics of hand washing and, you know, protecting oneself and protecting others is different than we're seeing here in the United States. You know, we're a country of freedom of rights, and I think you know, potentially that is right now leading to you know, to a worse outcome. So that'd be one thing. I think the other is, you know, our country has been challenged by testing. And testing is important so that, you know, the individual knows, the employer knows what the status of an individual is so they can protect oneself and protect others. And so we really are still standing up, expanding our testing capabilities, making sure we understand testing, because there are things called false positives. You probably have read, I hope, a lot about the antibody testing and the controversy there. 60 Minutes covered a good story on it this weekend. And then the final is, you know, it's tracing and tracking. And I think because our numbers, as you saw in the very beginning, are so large, and our population is so large, we have not had the manpower to do the tracing. And the tracing would be, you know, if I as individual was positive, tracing back who I've had contact with. One, we've been more open. So, you know, the likelihood as an American worker or individual, I've had a lot more contact. So the tracing gets more complex. And then, you know, our infection rates have that many more people that need to be traced. So, you know, that system and other countries, I believe, is having a much greater impact than we've been able to have here in the US.
The last question.
So what does it mean that Orange County has been placed on the watch list with the governor as it relates to COVID-19?
Well, the watch list means that we could go backwards if we don't improve our numbers from both the ability to have ICU capacity as well as hospital bed capacity. Generally, the state looks at a baseline of an 8% infection rate. And Orange County is, I think we're getting close to 9%, which puts us on the watch list where we may have the state issuing shutdown orders again. In other words, close your business, stay at home. We need to reduce that infection rate. We're starting to see when we're on the watch list now, it means pay close attention to all those protocols to see if we can reverse the trend. And all of the counties around us, which I mentioned in my remarks, are all either shutting down their bars and beaches in order to try to do that. In Orange County, we're not an island. And so we got to also watch, because we get impacted by all of those numbers when people cross boundaries. So we have not been ordered to shut down our businesses yet. And again, I urge us, now that we're open, let's stay open and mask up and practice safe protocols, washing your hands, etc. So. Mark, you're the expert on some of those numbers.
No, you're saying all the right things. You're giving all the right guidance.
Well, thank you so much, all the panelists and the participants. I really appreciate your time. I hope you got information that'll help you deal with the situation that we're all in, and hopefully we'll see a better tomorrow. Thank you.
Thank you all.
Thank you.
Bye now.